A lot of organizations are under pressure right now to show that they're doing something about mental health. And so they do things. They train mental health first aiders, they roll out an EAP, they build a wellbeing portal, they put resources on the internet, they tick the compliance boxes. And on paper, that looks great. But here's what we see when we go inside some of these organizations. People are still struggling. Managers and staff are still unsure what to do. And the systems that were supposed to help them are largely sitting there unused because nobody understands how they work or what they connect to. And that gap between what exists on paper and what actually happens in real life is one of the most common issues when it comes to this subject. So let's talk about where it comes from. Mental health first aiders are a great example. The intention is right. Having trained visible people in the organization is genuinely valuable. The problem is, in a lot of organizations, the people doing that role aren't clear on actually what they're supposed to do and where their responsibility starts and where it ends and how they connect back to HR or to the EAP or to the line manager. And so what happens is one of two things. Either they hold back because they're scared of getting it wrong, or they take on far too much because nobody taught them how to hold boundaries and not burn themselves out. And neither of these outcomes help anyone. Then we've got legislation. There is increasing pressure on organizations to show that they are taking reasonable steps. So they train people and they have systems in place. And that pressure is just going to continue to grow. But legislation gives you a framework, but it doesn't create a culture. You can technically comply with everything that's asked of you and still have an organization where people don't feel safe to say that they're not okay. Because the thing that actually makes the difference isn't the portal or the policy or the mental health poster on the wall. It's people who notice and recognize things that can contribute towards poor mental health and ask questions. It's the team where people believe it's actually safe to be honest about what's going on with them. It's the leader that models their own well-being matters and that asking for help is not a weakness, and that's culture. And you can't build culture within this sort of framework system. What we see is organizations that are getting this right, and when the structure and then the culture come together, it's fantastic. Mental health first aid is doing what they're designed to do. Watching, listening, responding, and working inside culture is what this is really about. Managers doing their part, noticing, checking in regularly, showing genuine interest in their team, not because they've been told to, because they understand why it matters and that the culture is important. And HR and leadership creating those conditions for all of that to happen, making it safe, making sure that the systems exist and support the culture. The real change happens where structure and relationship come together and meet, where someone can say, I'm not okay, and they know that that person will know what to do next. That's not about compliance. That's all about culture. And the organizations that want to close the gap between the two are exactly the kind of organizations that we love working with.